How dare they? President Obama, Democratic leaders have decided to bypass a formal House and Senate conference committee in order to reconcile those two health care bills. Instead, White House and Democratic leaders will hold informal, that's another word for secret, negotiations, meant to shut Republicans and the public out of the process. What a far cry from the election, when then-candidate Obama pledged to, quote, broadcast health care negotiations on C-SPAN so that the American people can see what the choices are, unquote. President Obama hasn't even made a token effort to keep his campaign promises of more openness and transparency in government. It was all just another lie that was told in order to get elected. The head of C-SPAN wrote a letter, asked Congress to, quote, open all the important negotiations, including any conference committee meetings, to electronic media coverage, unquote. When White House Press Secretary Robert Gibbs was asked whether the administration would support televising the negotiations, he refused to answer, instead mumbling something about, well, I haven't seen the letter. That wasn't the question, Mr. Gibbs. You either support openness or you don't. The Democrats insist this is all on the up and up, with House Speaker Nancy Pelosi saying, quote, there's never been a more open process for any legislation, unquote. Oh, really? This is the same Nancy Pelosi who, you may recall, after becoming Speaker in 2006, promised the Democrats would have, quote, the most honest, most open, and most ethical Congress in history, unquote. Here's hoping the voters remember some of this crap when the midterm elections roll around later this year.
Tonight, many Republicans are saying, I told you so, as the White House is downplaying a new report from its own Center for Medicare and Medicaid Services. Either way, there are new numbers about the new health care law, and it turns out there may be a laundry list of unintended financial consequences. Chief Washington correspondent Jim Engel has the highlights.
The report on health care comes from the actuaries of Medicare and Medicaid, who lawmakers say call the balls and strikes. And critics of the legislation say the findings are troubling.
Well, the first thing that's very sobering is that 14 million Americans, according to their calculation, are going to be losing employer-based health coverage.
Because employers will find it less expensive to pay the fines than to offer insurance and will therefore drop coverage. That may cost individuals more, but the actuaries also found the nation as a whole will be paying more.
We're going to spend more, not less, as a nation on health care. Reform was supposed to be about getting this monster under control, and it's going the wrong direction.
The actuaries found that under the new law, national health spending would increase by $311 billion over the next 10 years, $89 billion more than previously thought, though that is a small percentage of total spending, which would be more than $35 trillion. The report also found that 18 million people, more than half the 34 million who would gain health insurance, would be forced into Medicaid, health care for the poor. But Medicaid reimburses so little, many doctors and other providers cannot afford to participate. The actuary's report says it is reasonable to expect that a significant portion of the increased demand for Medicaid would be difficult to meet, particularly over the first few years. The actuaries also noted the cuts to Medicare are likely to be deeper than thought. Original estimates put it at $475 billion. They'll now be $575 billion. Even worse, the actuaries noted once again those cuts are counted twice. Once to extend the life of Medicare, but then spent again to pay for new subsidies for insurance.
It doesn't make any sense if you're taking that very same money and creating a new entitlement program.
A separate report from the Congressional Budget Office this week estimated 4 million households would be hit with tax penalties under the law for failing to get insurance. And Holtz-Eakin says that adds to an even bigger problem, that 21 million will be left uninsured even after all this goes into effect.
In this grand effort to expand coverage, we have missed exactly the group of people who probably deserve to get coverage, the poorest of Americans.
White House officials declined an opportunity to comment, but in a blog, one official rejected the criticism, saying the focus now is on implementing the law quickly and effectively, and that they'll continue answering questions about how it will work, but with different answers, no doubt, than the ones the actuaries